Hi friend, this is Dr. Magaranna from Magasam. Welcome to my YouTube channel. And today's our topic is clinical feature of diabetes mellitus. So let's get started. Clinical features of diabetes mellitus. Type 1 diabetes mellitus and type 2 diabetes mellitus. There are two types. In type 1 diabetes mellitus, polyuria, polydipsia and polyphagia. These are the three main symptoms or called as 3Ps of diabetes mellitus. These symptoms occur abruptly or very fast in case of type 1 diabetes mellitus. But type 2 diabetes mellitus, these symptoms occur very slowly. Initially, there are no symptoms. That is, type 2 diabetes mellitus initially asymptomatic, but it is onset is very fast in case of type 1 diabetes mellitus. Here it is weight loss occur. Triple P with weight loss, that is polyuria, polydipsia, polyphagia. Along with there is weight loss. There is a polyphagia, that is increased eating, but still there is a weight loss. It is a paradoxical condition, that is opposite condition, but present in type 1 diabetes mellitus. It is occur mostly below the 30 years of age, and it is occur more than 45 years of age. Here weight gain is occur in type 2 diabetes mellitus, but type 1 diabetes mellitus there is a weight loss. You should remember this. Why there is polyuria? What is the cause of polyuria in type 1 diabetes mellitus and type 2 diabetes mellitus? In both the diabetes mellitus, that is type 1 diabetes mellitus and type 2 diabetes mellitus, in both the cases glucose is high. And threshold value for glucose, that is 180 mg per deciliter. Above this, when the glucose level is more than 180 mg per deciliter, the excess glucose goes into kidney for excretion, and it does not go alone. It drags the water along with it. And this is how polyuria occurs in case of diabetes mellitus, because glucose is osmotically highly active molecule. It does not go alone with the urine. It drags the water along with it. So there is a polyuria. That's why it is the cause of polyuria. Hyperglycemia itself is the cause of polyuria. Hyperglycemia is nothing but the increase the blood glucose level, increase the BSL, blood sugar level. Since there is a polyuria leads to polydipsia, because excess water or there is a water loss from the blood. The blood becomes concentrated, and since there is water loss from the kidney, so thirst center in the brain get activated, and we feel to drink the water. That is, there is a feeling of drinking of water. This is how polydipsia occurs. Normally, this glucose enters into this target organ. This is skeletal muscles, adipose tissue, and liver. Here is the tetrameric receptor, that is the insulin receptor. The insulin comes, binds with this receptors, GLUT4 channels open, and from this GLUT4 stored in this target organ. This is skeletal muscles, this is adipose tissue, and this is liver. In this target organ, glucose gets stored normally, but there is type 1 diabetes mellitus, there is no insulin, and it will lead to hyperglycemia. But these organs require glucose for ATP synthesis. Since these organs get starvation, these organs does not get the glucose. There is no ATP synthesis. So these organs utilizes the proteins and fats, and our body is made up of fats or proteins. Initially our body is made up of proteins. Then excess fat get accumulated over the body, and this is how our body forms. But there is no insulin, there is no glucose for energy production. So these cells utilizes, this target organs utilizes the protein for energy production. Utilizes the protein for energy production. So there is a weight loss in case of type 1 diabetes mellitus. Weight loss, because proteins are degraded for ATP synthesis. So there is a weight loss, and since because of weight loss, brain feels hungry. That is, in the hunger center in the brain get activated, and we eat more. That is the type 1 diabetes mellitus, polyphagia in type 1 diabetes mellitus. These are the causes of polyuria, polydipsia, polyphagia. Polyuria leads to polydipsia, and polydipsia and polyphagia. Weight loss leads to polyphagia. Because of weight loss, the brain center, the hunger center in the brain get activated, and that will cause to eat more, and person eat more. That is polyphagia, means eating more. Thank you.